You're watching news at Prime. Let's get into this conversation now. Health Minister Dr Aaron Motsoaledi says HIV must be eliminated as a public health threat by the year 2030. He says this can only be achieved if more people are on antiretroviral treatment. Motsoaledi joining us now to expand on this new campaign. Minister, good evening to you, and thank you very much for your time. I'm quite keen to understand exactly when you say HIV must be eliminated as a public healthcare threat by the year 2030. Just give us a little bit more on that. What do you mean exactly?
Thank you, Toli. Thank you very much for having me. Thank you to the listeners and viewers. We mean exactly that, Toli. But that come the year 2030, we must no longer be talking about HIV/AIDS in the manner in which we're talking. It must stop spreading. In other words, by 2030, the incidence of having 150,000 new infections per annum should have stopped. And the route to that has been outlined by UNAIDS when they came out with the concept of 95-95-95, which they came up with as far back as 2014, starting with 90-90-90, then they moved to 95-95-95, meaning that 95% of people in a particular country or a particular city must know their HIV status. And if after those who know their status, those who are positive, 95% of them are put on treatment. Yeah. And if out of those who are on treatment, 95% of them are virally suppressed, it means they can no longer transmit the virus from one person to the other. When that time arrives, then you will say we have eliminated HIV/AIDS as a public health threat. So basically, that's what we are talking about. So where are we at the moment? We, as South Africa, were at 96, 79, 94. Now, as you can see, we are very, very behind on the second 95. We're still at 79%. And our calculation is if we bring 1.1 million people who are known to be positive, that means they are part of the 96%. Which already know their status. They are part of that. Yeah. But they are not on treatment. If we bring them on board on treatment, then we'll have reached our second 95. And if 95% of them become virally suppressed as expected, if they keep on treatment, then we can say HIV/AIDS has been eliminated, not eradicated, but eliminated as a public health threat.
Very interesting comments there, Minister. So 1.1 million people are known to have this virus, but they are possibly not on treatment, which means that they are potentially the spreaders of this particular virus. Is it safe to assume that most of these people are men?
Absolutely. It's not an assumption, actually, it's a fact. Because, yeah, it's a fact because 600, remember we know these people. It's not the guesswork. We know them because they've been tested. Some of them were on treatment, they stopped it. Others just tested, they didn't start treatment. So it's not that we don't know them. We know, even in numbers, 600,000 of them are definitely men.
Yeah. How do we bring
the
them?
The remaining is shared between women and children.
Yeah. How do we bring the men, people like me, who resist going for checkups, even if I feel fluish, I just won't go to the hospital? What is the plan, Minister, to try and encourage men to come forward?
That's exactly what I said today. What you are seeing were actually my words, Cody, because it has always been a problem. Remember back 15 years ago, when we launched the world's biggest HIV counseling, testing and treatment campaign, after 18 million people were tested, 65% were women. 65% were women, and the remaining 5% were children. Men were only 30% who participated. So we know that the health-seeking behavior of men is very difficult. It's not easy to find them, but we have launched a men's sector, and today they spoke who are going to help us look for those men But the manner in which we are running the campaign also has got granular details. We are not just shouting that we are going to look for 1.1 million men. We have looked in each and every province how many each province must look for out of that 1.1 million. From there, each district, from there, each clinic and every hospital. So you may find that in one clinic, they only have to chase three people, 3, 5, or even 10 people if it's more in each clinic. So when you talk a million, it's scary. But when you break it down right up to the lowest level, you stand that you see that this is work that is doable. We've got a person who's coordinating this work. MECs are going to lead it in the provinces. We will encourage, today I said they must encourage mayors to lead in their district and municipalities so that we work very hard to identify these people. We've got community health workers who are also going to try and help to trace them.
Yeah, this can be tricky, Minister, and I don't like using this word tricky. This can be a potential risk in terms of when you say that the mission here is to try and get them to be on treatment. Number one, a person's health status is confidential. They don't have to disclose to anyone what they are suffering from. So how do you go from tracking and tracing to now identifying that that person possibly lives with this virus, but how do you get them to admit to that without them complaining that you are invading their privacy?
But they came to us for testing, Claude. Any person who comes and brings themselves forward to test knows that whoever is going to test them will know their status. And we have got 5.5 million people in the country who have tested and are on treatment, and health workers know their status. And every month or so, they go to collect treatment. Some even collect treatment every three months. We've got remember, we have got a program called CCMDD, Central Chronic Medication Dispensing and Distribution, where some of those people who are stable don't have to come to our clinics. They bring their names. They bring their names. We give their names to a service provider, and the service provider is giving ARVs or whatever medicines, and they package them and go to deliver them at a particular given address.
Wow.
We also have those, yes. So people are no longer necessarily hiding. We know there's an issue of stigma, but they are not hiding because we encourage them not to hide. So they came forward, they got tested. We know they are negative. They don't have to disclose their status. We know it. All we want is to encourage them to be on treatment.
Yeah. So, Minister, let me then talk funding, because that for now is a major headache for you. The last time you were speaking about HIV, it was on the back of President Trump and him cutting aid to the country. In fact, your last comments in the media were that the government of South Africa was snubbed by Washington when seeking answers on this funding freeze. So we're now looking ahead to the Minister of Finance, who's going to deliver a budget soon. Do you anticipate, or is your department among those that will be allocated, among others, money for HIV?
Let me correct the first thing, Cody. The word snap was never used by me. It was the media who were interpreting what I was saying.
Right.
All I said is that we've not been informed by the US government. Remember, they were writing NGOs, they never informed us. So we checked with DERCO, because they might have spoken to DERCO. We found that there was no communication. We checked with Treasury. Treasury said there's no communication, and they tried to contact the Embassy of America. They couldn't get anybody. Remember, they don't have an ambassador yet. It was just freshly after Trump was inaugurated. So Treasury said no. They also could not trace them. So when I told that to the media, they translated it into the word snap. I just want to correct that.
Yeah.
Now, let's come to the issue of budget. We have mentioned that South Africa buys its own ARVs. 90% of the ARVs people are taking are bought from the fiscus by the South African government. The money has been there. That's why we've got 5.5 million people on treatment. And 10% is paid for by the Global Fund, which is based in Geneva. So in terms of ARVs, we are not short of them. The PEPFAR funding that Trump made announcement about is only in 27 districts and 15,000 workers working those districts out of a total of 271,000 workers. 271,606 are workers in those 27 districts, and 256,452 of them are paid for by our own government. So the problem here is 15,000 workers in those districts and not ARVs, because ARVs, we have got them, we buy them on our own. So that's why we could go on to launch this campaign today.
So those 15,000 workers, Minister, what's their fate today?
Well, remember that after there were too many announcements made, and at the moment, I mean, we're still not sure because announcements change every day. But for now, we are keeping to the announcement that there's been an exemption and they must go on for 90 days. And during this period of 90 days, we are working very hard as a government to see what we can do about it.
Let's wrap it up. I want to talk quickly, one question, I promise, on the NHI. The last time you distanced yourself from what has been described as an informal NHI deal struck between the Minister of Planning, Monitoring and Evaluation and some Democratic Alliance officials, if I could put it that way. Where are we on that?
Well, up to today, nobody has owned to the presence of such a deal. I told you that I don't know about it. I was just not distancing myself. I was saying if there was such a deal, if there was a meeting for such a deal, I was not part of it and I know nothing about it. So up to today, nobody has ever said they own up to that deal.
Wow. Interesting indeed. And that meeting, that cabinet meeting, that's been going on around the budget. Are you willing to share any information on that?
Yesterday,
how did that go? Yes.
I did attend the cabinet meeting yesterday. Yes, it took 6 hours, but I can't talk about it because I'm not authorized to do so. Cabinet has got a spokesperson which you could conduct, but I attended that cabinet meeting. It took 6 hours. Unfortunately, I left before it was finalized because I had to fly back to Gauteng in order to launch this HIV/AIDS campaign today.
How would you gauge the temperature inside that room?
Oh, it was very cool. Very, very cool. It was very, very cool. In both ways, and the physical temperature.
Okay, all right. Minister Motsoaledi, it's a pleasure to talk to you. Thank you very much, as always, for availing yourself. Dr. Aaron Motsoaledi, the Health Minister.